We'll have a very important talk. In fact, it's the first talk of the session. Pearls for financial planning for beginners. And anyone who's starting practice, getting a right financial advice is very important. Uh, we do have lots of sessions and information available on the practice part and on the ophthalmology part. Over to Dr. Jignesh for this interesting talk.
Thanks, Dr. Gagan, for the kind introduction. At the outset, I would like to again thank the AIOC Scientific Committee and Dr. Partha Bishwas to have given me the platform to talk such an important topic. Well, my target audience, as I rightly said, is the beginners. Well, they know, because I have faced a lot of issues during my initial years. We did not know how to approach this, and a lot of money had gone down the drain. So financial planning, first you need to do a proper budgeting. You need to work out the approximate cost of your infrastructure and instrumentation as a general ophthalmologist in case. And if you are a super specialist, you have to have a proper budgeting of what you are going to go an outright buying of the place and then installing an instrumentation, or you are going for just for a rental clinic or a center and buy basic equipment and take advanced instrument on a rent. If you take a rental clinic and buy all equipment, so these are three options where you have to budget each and everything in this. Arranging the finances, for that you have to create a proper project report. If bank lends you money, you need to submit a blueprint how your earnings are going to grow over the next 5 years after taking care of expenses. Arrangement of margin money, around 15 to 25% is what is required of the total loan. You have to generate on your own and pay at the time of loan disbursement. No bank gives a 100% loan unless it is personal or an unsecured, wherein the interests are very exorbitant. Margin money comes from your savings, your help from a friend or your relatives and your parents. Always go in for a nationalized bank, as the rate of interest is much lower than the non-nationalized banks and there are no hidden charges. Go for a moratorium and a staggering payment. Moratorium is a period free of paying the AMI. You may take it for 6 months or 1 year, where you try and establish your initial days of practice. Never take credit card payment. Remember this, they charge 21 to 36% of the rate. Even a 1 day late payment, you will be charged at 21 or 36, depending upon which credit card you have availed of. Don't try to skip an EMI. As the interest starts building up initially, the interest component is much more in the initial years. Remember this, than the capital component. So the more you miss that, you pay more the interest. Always take daily loan on a daily or a monthly reducing balance and not a fixed rate, wherein you pay much more interest. Ask the bank which type are they giving before finalizing. Otherwise, they just give you an EMI chart and you have the least idea of what type of interest they are charging. The list of the nationalized banks as per the RBI, these are the list if you can take a screenshot. The SBI, Punjab National Bank, Bank of Baroda, Bank of India, BOM, Canara Bank, UBI, Indian Bank, IOB of Indian Overseas Bank, Punjab and Sindh Bank, UCO and CBI. So these are the banks you should go in and avail this. Now, budgeting, how you're going to do, how much allocation of your income from day-to-day cash expenses for the clinic and EMI, repayment of the loans, how much for the staff salaries, margin money for buying the new equipment. Again, all the insurance you have to keep in mind, the Mediclaim, the life insurance, professional indemnity, your utility expenses for telephone, cell phone, MSEB, property tax, professional tax, biomedical waste and a housing loan. Personal expenses and paying income tax. Of course, do file your returns in the very first year of your practice, even if it is nil to start with, because it saves. Because what it gives you is builds your white corpus. Whenever you are going for that 25% or 15% of your margin money, this is going to help you. The savings you should do in on FDs, mutual funds, shares and golds. Of course, it's a big investment topic which we'll be doing later. How do you reduce your overall cost? So when you're going for buying loans for equipment or for your infrastructure, you need to negotiate. Leverage the suppliers, buy need and not potential. Their potential पूरा अपने को ये LASIK ले रहा, मैं भी ले लेता हूँ, but whether you have the need for it, whether you have the target people and the consumers for that. Trade time for discounts, buy bargains, reduce waste, replace cost to expiry medicines and other consumables. These are very basics. If you follow this, you're going to save a lot of money. Computerized and paperless communication. Of course, Go Green is the initiative, loans from the bank, and of course the staff management. How are you going to generate your income initially? So that you at your center, you have the OPD consultation, operation, diagnostic and procedures, professional income from the institute that you are attached with, Some sources as above, you have the optical shop, the contact lenses, and low visual aids. Generating more surgeries at a discounted rate by conducting free diagnostic camps at the satellite centers once in a month, initially on a Sunday, and that also should be a non-working day, because you should not leave your primary center. Visiting peripheral rural area by conducting outreach eye checkup camps in the rural area once a week, fortnight, a month, thereby having a good surgical inflow from such camps to your main center. It does help. Conducting paid subspecialty training. In case you are a good subspecialist, you can start taking wet labs and tutorial for the general ophthalmologist. And of course, you need to advertise in a different way, in an ethical way, in the newsprint, having lectures, in the NGOs, radio and TV public appearances for a better outreach to the general public and becoming a face in the crowd. Which instrument you need to invest initially depends. Again, basics. If you're a general ophthalmologist, you need to work out an OPD chair unit, slit lamp autoref, keratometer, direct, indirect, and tonometer. These are the basics that you have. Rest of the instrument as per your subspecialty. Okay, OT equipment again. If you have cataract is a bread and butter, the phaco machine does come. The chair unit. The Indian ones are very good and highly discounted. Nowadays, they're at par with the international equipment. So you should bargain and take it. Rest of the equipment is as per your subspecialty. OPD and the OT equipment and instruments should be bought in a conference like this, an annual conference where there are a lot of discounts going on for good quality instrumentation. Here, group purchases are good. Now we have seen Dr. Senthil has formed a very nice group for group buying. So that is one of this which you can go. Otherwise, your colleagues, you can form a group and buy. And at individual level, again, you try to negotiate influence of your seniors. Let me know, Gagan, when 2 minutes are left, please. Buy the same product from the vendor company who is trying to establish inaugural offers you get. Then if a vendor is giving good equipment, product and prompt services, recommend him to other colleagues. So at the next time, he'll give you at a discounted rate. Do good market research for your equipment. Best time is the annual conference, as vendors from all over the country are available. See the same product, try and tap as many vendors. One who offers the lowest with the favorable payment terms. They give you EMI, they arrange for your bank loans also. So try and get it at the lowest interest rate with the best of the equipments at a discounted rate. Well, Toyota Motor Company had done a saying, is considered the father of just-in-time production. So whatever is required to make frequent deliveries eliminates excess inventory and carrying costs. Like we have IOLs, contact lenses, and surgical items and medicines. The lessons for a smaller center here is not to buy inventory or equipment until you need it. It's very important and determine immediate benefit in either the lower cost or improved patient benefit. Trade time for discounts. Buy in bulk with a condition to pay on using only. I have 100 IOLs. I use 5 this month. I pay only for 5. That is how the payment should go. Some vendors, to reduce the inventory, take this route. As you know, doctors are never defaulters. So you earn and pay with the great benefit of having the full inventory. So advanced inventory costs are saved. Long-term supply agreement over a period of time, you give value for money and great discounted price. Fix a vendor and stick to him over a longer period, so you'll get prompt service and discounted price. Buy bargains. Look for opportunities where discounts are offered. When vendor wants to clear old stocks, new models are coming, he would like to sell off that, and if it is a good product, do buy. In conferences, try and see and buy it at bulk. About 10 people, 20 people buying, you get about 20-25% discount. Also established in newer launches, they try and give it discounted. Closing down the vendor businesses, they sell off this. Annual clearance sale to buy new stocks. They want to clear their own bank loans, so they clear good equipments. Do cash purchases. They always give a discounted if you try and put all the cash down. Reduce waste. Keep a regular tab on your inventory. Tell your staff to check once in a month for small setups. Replace close to expiry medicines, consumables, IOLs, and contact lenses. A lot of wastage is saved in such thing. Stock only fast-moving consumables and medicines. Computerization, paperless is the in thing which is going on now. We have all the digital media, and Dr. Gopal is also going to speak later on. Email, WhatsApp, SMS are very useful. Wherever feasible, try and use the electronic mode, so you reduce space for the inventory. For each job you need to replace with a machine and computer, the cost comes down drastically. For example, machines do not form unions. They don't go on strike. They don't need health insurance, and they do give work on time. So it's a one-time investment, no monthly salaries. Loan from banks. Take loans only when you need utmost, as higher interest rates have to be paid, higher the loan amount. Check interest rates. Usually nationalized bank offer the lowest. Try prepaying the loan. It's much lower interest than when spreading out over a longer period. Don't spread it out for 10 years just because you have that convenience. Try and pay it off fast, you pay less loan, less interest. Always opt secure loans because they give almost 5% less than the unsecured loans. Check the interest is whether on reducing balance of which I just said. Staff management, check your OPD and theater load. Depending on that, keep the staff. Keep part-time, especially if you're attached to multiple hospitals. Multitasking staff, train them for both the reception, OT work and counseling, especially nurses. It doesn't reduce the competency as people think. It's not so. Keep incentives rather than increase the salary. So they work hard for you and your practice is for it. It's an offshoot. Celebrate the birthdays, create a cordial atmosphere and a congenial practice. Then more interest is taken by the staff to develop your practice. Big thank you for having the patient listening. Thank you very much.
Thank you, Dr. Jignesh. Very interesting talk, though it is titled as for beginners, but I believe all of us would have some take home points from this and we can already use in our established practice.